So, first, this is my patient. I'm going to be walking into the room. I'm going to use my hand sanitizer. I'm washing my hands. I'm introducing myself. Hello, my name is Allison. I'm a student at Indiana Wesleyan. I'm going to be doing a head-to-toe assessment on you today, okay? So when I'm looking at my patient, I'm going to kind of move this down, I think, so you can see a little bit more of your body. There you go. I'm looking at my patient's demeanor. Does he seem to be in any distress? How is he sitting? What's his posture? Is he using any accessory muscles to breathe? Which he is not. I am looking to see his hygiene. He looks to be well kept, and his nutritional status seems to be fine. So we will go ahead and begin our exam. I'm going to start out by asking your name.
Brett L. Hankins.
Okay, and when is your date of birth?
November 2nd, 1963.
All right, and what city are we currently in?
Shelbyville, Illinois.
All right, and who's our president?
Joe Biden.
All right, so he is completely alert and oriented. He passed that test with flying colors, so we'll jump right into my exam. So I'm going to begin by doing my 12 cranial nerves. First cranial nerve is the olfactory, so what I'm going to do is I have an object here that is a scent. I'm going to put it under your nose. Please close your eyes and tell me what you smell.
Vanilla.
Correct, so that is intact. We're going to move on to the optic nerve. This is where I would use a Snellen chart. I do not have one for the wall to stand 20 feet away from, so we're going to use this handheld Snellen chart. What I'm going to do is hold this here. I'm going to have you cover one eye, and please read the lowest line you can.
DHJBS.
Okay, and that is 2040. I will have you switch to the other eye.
EFTZO.
That's 2030 for his right eye. Now I'll have you do both eyes open.
LTFPH.
And that is 2020 with both eyes. I'm also going to do the peripheral vision test, so I'm going to have you look out against that wall. Tell me when you can see my fingers.
Now.
Okay, we'll do the other side.
Now.
All right.
Now.
All right, peripheral vision is intact, optic nerve is fine. We will move on to the oculomotor, the abducens, and the trochlear. So what I'm going to do now is check your pupils. So I'm going to have you look here at me, and I'm going to look and see if they constrict and dilate. Constriction with dilation. Constriction with dilation. Pupils there, and then I will have you follow this pen into your nose. Do not move your head. Perfect. Accommodation is intact. Pupils are perla. And then we're going to check for your 6 fields of vision here. I'm going to have you follow this with just your eyes, not your head. Looking for any nystagmus during this. Currently, we do not have any of that showing. So those nerves are intact. We will move on to the trigeminal. For this, I'm going to feel here. Clench your jaw for me. Open and close. Perfect. No locking or popping. Open against resistance. Wonderful. And then that is intact. I am going to go ahead and move on to the facial nerve. So I will have you clench your eyes closed, tight, okay? And smile big for me. Show your teeth. You can open your eyes and you can frown for me. And then puff your cheeks out real big. Perfect. Facial nerve is intact. We will move on to the auditory or the acoustic. So what I'm going to have you do is cover this ear for me. I'm going to whisper something.
Cat.
Okay, again, we'll do the other side.
Dog.
All right, so the acoustic nerve is intact. And then now we will do the glossopharyngeal. So I'm going to shine the light and use my tongue depressor here. Looking in, and then I'm going to have you say, gag reflex. All right, gotcha there, so that is intact. I'm going to check the hypoglossal, so I'll have you stick your tongue out and move it side to side. Perfect. And then the vagus nerve, he's been talking appropriately. I've been watching him swallow, so I don't need to assess that any further. It is intact. And then I will do the spinal accessory here. So I'll have you check your chin to your chest and back. And then can you look this way and the other way? And then shrug your shoulders up against me. Perfect. So spinal accessory is intact. We will go ahead and move on to the rest of our exam. The 12 cranial nerves are fine. I'm starting out with the head. I am looking at the symmetry of the face. I am looking At the head symmetry, normocephalic, I am looking to make sure it's midline. No lesions. I'm looking at the hair distribution, making sure that there's no areas of baldness, and everything seems to be fine. So I'm going to go ahead and palpate any pain or discomfort with that. Do you have any?
No.
Sorry.
Okay.
You thought I was talking to them.
Yeah.
All right. So now I'm going to move on to the ears. So I am feeling the external ears. I am feeling the lobes, the tragus, making sure there's no swelling or pain. I don't see any discharge. I'm also checking for symmetry of the ears as well. And so everything is mobile. The lobes are mobile. Ooh, about to lose you. There we go. Thank you. And so that is the external ear exam. So I'm going to move on and go to the internal exam.
That's so good, my hair. That's what that is.
Oh, that's all right. And then this is going to look into your ear canals. So I am looking to make sure that the canals are clear and that I can see the tympanic membrane, which looks good. The tympanic membrane is a silvery gray color. I do not see any redness or any issues in the inner ear. Look on this side. All right, nice and clear. No issues with hearing. Have you had any issues with hearing?
No.
All right, so the ear exam is finished. We'll move on to the eye exam. Most of the eye exam I did during my cranial nerve check. I checked for peripheral vision, the EOM, and the pupils were perla. I was also assessing the sclera. I'm going to go ahead and check the conjunctiva, so I'll have you look up. It's nice and pink. I'm looking at the distribution of his eyebrows and his lashes, which don't seem to have an issue. So I'm going to do my fundoscopic exam, and I'm also going to be looking for the red reflex. So just look here at my nose. All right, red reflex intact. Vasculature looked good on that side. Same over here. Sorry, I know that's right. So the eye exam is finished. We will move on to the nasal and sinus exam. So I'm going to feel the sinuses, any pain or discomfort there.
No.
Okay, how about down here?
No.
No. All right, I'm going to shine a light up your nose, looking for the septum, any deviation, which I don't see. We'll go ahead and check for patency of the nair. Now you close one side, breathe in and out. Okay, other side. Very good, it's nice and patent. And then, so that's the nose exam. We would move on to the mouth, which I did mostly during my cranial nerves. So I was looking at his lips and making sure that the color, the dryness, are there any cracks or sores. I looked at his gums when he had his mouth open to make sure they were pink and moist. I was looking at his dentition, which seemed to be in good standing. He didn't have any cracked teeth or any issues that I noted. I looked at the back of his throat to make sure there was no exudate, there was no redness or cobblestoning. I made sure that his uvula was midline, his tongue was midline, his tongue did not show any sores. I was looking at the buccal mucosa to make sure it was pink as well. And so his mouth exam was fine. I don't have to reassess that at this time. So now I will go ahead and go on and check for lymph nodes. I will stand on this side so you can see. So I'm going to start here in the front, pre-auricle. This is post-auricle, and I move on back to the occipital area to feel. And then I come up here to the submental, underneath the chin, moving my way back to the submandibular. I'm feeling for superficial and for deep. And then I go to the supraclavicular, and I go on back here to the post-cervical. I did not feel any lymph nodes, which is a good sign. While I'm at the neck, I'm also checking to make sure that the trachea is midline, which it is. And I'm going to feel for the thyroid, so I'm going to have you swallow for me. Okay, I do not feel any nodules or asymmetry in the thyroid. And the thyroid's not felt, so that is a good sign. While I'm at the neck, I'll go ahead and listen to the carotid arteries and feel, so I will feel one at a time. +3, +3, and then we will listen. So I'll have you turn your head that way, and I'm using the bell of my stethoscope here. Big deep breath in and hold your breath. Okay, you can breathe, and we'll do the other side. Okay, no bruise are heard in the carotid arteries there. Now we will move on to my chest exam. So I am feeling here on the chest, feeling for any crepitus, pain. Any pain felt with that?
No pain.
Okay. I'm also going to feel for heaves and thrills here on the chest. Do not feel those, so we will start with the posterior lung sounds. For this, I'm going to use my diaphragm. I'm going to listen to 6 different areas in the lungs, posteriorly. Big deep breath. Two more times. Okay. Posterior, the lungs are clear through all fields. Let me get this turned back on so we don't lose you. Okay, and then I'm going to do lateral lung sounds. So if you could take a big deep breath for me. One more. All right, lung fields are clear laterally. Big deep breath. All right, so you can breathe normal. All lung fields are clear, including the bases. There's no adventitious lung sounds. I will go ahead and go on with my cardiovascular exam. I'm going to listen to the 5 points of the cardiovascular, which are second intercostal space, and this is your aortic. Moving to the other side, second intercostal space, pulmonic. Third intercostal space is Irby's point. Fourth or fifth intercostal space is your tricuspid. And then your fifth intercostal space is your mitral, apex, apical, whatever you'd like to call it. I'm going to go ahead and listen again with my bell, those same areas. And noticed a regular rate and rhythm. Normal S1, S2. No murmurs are being heard. Okay, and while I'm listening here to the apical pulse, I'm just going to go ahead and feel these pulses here. Radial, +3. We'll do brachial. +2 for those. And then we will go ahead and do our abdominal exam now. Before I have my patient lay on back, I am going to check for CVA tenderness, which is in the back. I'm going to go under the 12th rib here. You're going to feel me kind of pulsate on your back, so let me know if you have tenderness.
No tender. Good.
Okay. All right, so I will pop these blankets down, or pillows, I should say, and we'll leave this one up, and you can go ahead and lay on back. We're going to examine the abdomen. I will note that throughout this whole entire exam, I am looking at the skin. I'm addressing it, looking for any lesions or anything that looks abnormal. If I find something that meets the ABCDE criteria, I would make note of that. So asymmetry, borders, color, diameter, and evolution. So if I find anything worth noting, I will let you know. So typically when I'm doing an abdominal assessment, I do lift my patient's shirt up to show their abdomen. but we're not comfortable with doing that on camera, so I'm just going to leave his down. So I'm looking at the symmetry of the abdomen. I'm looking at the umbilicus to see if there's any hernias or anything like that. And then any masses that I see in the abdomen. The curvature and everything looks fine, so I'm going to go ahead and listen. First with my diaphragm. All 4 quadrants are normal active. While I'm here, I'm going to listen to the arteries of the abdominal, so I'm going to listen to the aorta. No bruits, the renal. No bruits, the iliac. No bruits, and I would also do the femoral, which is located here in the groin on both sides, but I will not be listening or palpating those, but I would in real life. And now I will go ahead and do my palpation. So I'm going to do light palpation here on the abdomen. Please let me know if you have any pain or tenderness.
No pain.
Okay, a little deeper palpation. Pain or tenderness?
No.
Okay, I'm going to percuss here. And then I'm going to have you take a big deep breath in, and I'm going to push up here when you let it out. Pain? Okay, and again. Alright, so no organomegaly noted there. Abdominal exam is normal. He had no rebound tenderness or anything like that. So now I will move on to my lower extremities. I am assessing the lower extremities. I'm looking for any varicosities, any edema. I would pull up the pant legs to see that. And right now he has no edema noted. In the lower legs or ankles, I don't see any varicosities. I'm going to go ahead and feel for the popliteal pulses. +2. We'll do the posterior tibialis here. Oh. Sorry. I think I might have lost you, but I think I got you back. Okay. And then we will do the pedal pulses. Sorry, I'm a little flustered from that. Okay, so pedal pulses. +2. When I'm down here at the feet, I would have his socks off. I would be looking in between his toes to see if there's any sores. I would be looking at the skin turgor. I would be checking calprefill, which would be hopefully less than 3. And so that exam is negative and good. We will go ahead and set you back up. While we're here, I'm going to check for the strength of his upper and lower extremities. So I am going to have you put your arms out. I'm going to push down, don't let me. Okay, and then up. Same, and then push out against me. Perfect, pull in. Wonderful, and then squeeze my fingers. Perfect. Strength is 5 out of 5 for the upper extremity and the hand grasp. And then I'm going to have you push up with one leg. Perfect, this side. Perfect, and then push out. Perfect, in. Okay, and then push like you're on a gas pedal. And then pull. Perfect. So strength is 5 out of 5 for all of his lower extremities as well. We will go ahead and do deep tendon reflexes here. So I will start out with the bicep. You can just relax your arm down here. You see a little bit of movement there, so that's good. 4 and 4. Okay, again. And then we will do the tricep. Just dangle your arm. Okay. Okay. We'll do the brachioradialis. In here. A little bit of movement there in the fingers. And then I'm going to have them scooch back. We will do your popliteal, or your patellar, I'm so sorry. Teller. Okay, and then I'm going to do his Achilles, which you can't really see, but I'm flexing his foot. I'm hitting his Achilles tendon, and I'm looking to see if his foot kind of pushes down, drops a bit. Okay, all right, so his deep tendon reflexes are all intact, 4 out of 4s. We will go ahead now and do a walking exam, so I'll have you stand up. I'm going to check your gait, just see how you're walking. Walk to that chair for me, just normal. Okay, his gait is normal. When you turn around and walk back, I'll have you do heel toe. Perfect, he's tolerating that well. And what I'm going to do is stand behind you and just have you bend over slightly so I can check your spine. It's not very flexible, so I can't have him bend down much more than that, but his spine is normal curvature. There, you can go ahead and stand back up. And then I'm going to do the Romberg's test here. What I'm going to have you do is put your arms out, flip them up. He will stand here for 30 seconds. I am just assessing to see if he has any pronator drift of his arms, which he does not. And then I would have him close his eyes. He would do this for 30 seconds. I know that he is able to withstand this test. If I was unsure or didn't know about my patient, I would stand close by because this is one where they can lose their balance, kind of. But he is doing fine, so you can go ahead and sit back. And that is, I believe, let me make sure I've got, here we go. It's all up, so I believe that's the end of our exam. So I would go ahead and wash my hands again, and I would go finish my charting. Thank you so much for allowing me to do the exam.